Glaucoma is a group of eye diseases that usually share common traits, such as eye pressure, damage to the optic nerve, and vision loss. Glaucoma diseases can result in gradual vision loss and blindness. Most kinds of glaucoma involve increased pressure on the eye. The eye produces a gel-like fluid called aqueous humor, which is secreted from the ciliary body between the iris and the lens. It then flows through the pupil between the iris and the cornea. From here, it drains into the trabecular meshwork and leaves the eye. For people with healthy eyes, the rate of secretion equals the rate of drainage. For a lot of people with glaucoma, the drainage canal is partially or completely blocked. The fluids build up, and this increases the pressure in the eye. The pressure drives the lens back, and it presses on vitreous body, which presses on the blood vessels and nerve fibers in the back of the eye. If left untreated, it will lead to blindness. Some forms of glaucoma may develop more gradually than others. One form of glaucoma is called normal tension glaucoma. It's also known as low tension or normal pressure glaucoma, and it's a form of glaucoma in which damage occurs to the optic nerve without eye pressure exceeding the normal range. The causes of normal tension glaucoma are still unknown. For some reasons, the optic nerve is just more susceptible to damage from even the normal amount of eye pressure, and research is still being conducted to examine, why some optic nerves are damaged by these relatively low eye pressure levels. When checking for glaucoma, eye doctors usually look for damage to the optic nerve in the back of the eye and any loss of side vision or peripheral vision. They may also check your eye pressure. The following risk factors may increase your chance of having glaucoma. Age is a risk factor, so the older you are, the greater your risk is. African Americans have glaucoma 4 to 5 times more often than others. If you have a parent, brother, or sister with glaucoma, you are more likely to get glaucoma as well. Having diabetes, previous eye injuries, eye surgery, or long-term steroid use can increase your risk of glaucoma. Anyone can get glaucoma, and glaucoma affects 1 in 200 people aged 50 and younger. The rate increases to 1 in 10 over the age of 80. Glaucoma can usually be treated and controlled using medication such as eye drops or surgery or a combination of these two treatments. Typically, the first step in treatment is to use medication. However, surgery may be just as effective as a first choice. It's really dependent upon the eye doctor. Since symptoms appear gradually, starting at peripheral vision loss, they largely go unnoticed until central vision is affected. So it's important that patients at risk or who have already been diagnosed with glaucoma see their eye doctor regularly.
Glaucoma is a disease that damages the optic nerve, the part of our eye that carries the images we see to our brain. There are many different kinds of glaucoma and many ways to treat it. Fortunately, early detection and treatment can help preserve vision so you can see all that life has to offer.
In the healthy eye, a clear liquid called aqueous humor circulates inside the front portion of the eye. To maintain a constant healthy eye pressure, your eye continually produces a small amount of aqueous humor, and an equal amount of this fluid flows out of the eye through a microscopic drain called the trabecular meshwork in the drainage angle. If you have glaucoma, the aqueous humor does not flow through the drainage angle properly. Fluid pressure in the eye increases, and this extra force presses on the optic nerve in the back of the eye, causing damage to the nerve fibers. Remember, glaucoma usually has no symptoms early in its course. Proper treatment can usually stop or delay any further vision loss. An evaluation for glaucoma is particularly important for those over age 60, relatives of people with glaucoma, people of African descent, and those with elevated eye pressure. While there is no cure for glaucoma and optic nerve damage cannot be reversed, we can usually prevent vision loss if glaucoma is diagnosed and treated, especially if it is detected in its early stages. Also, a recent study shows that some people who have elevated eye pressure but don't yet have glaucoma may benefit from treatment with eye drops. That's why it is so important to visit your ophthalmologist regularly if you are at risk for developing glaucoma.
Vision loss from glaucoma usually can be prevented if it's detected and treated early enough. Fortunately, there are a number of ways to treat glaucoma. While some people may experience side effects from medications or surgery, the risks of side effects should always be balanced with the greater risk of leaving glaucoma untreated and losing vision.
The Comprehensive Dilated Eye Exam, opening the door to preventing blindness. During a comprehensive dilated eye exam, the patient receives special eye drops that dilate the pupils. The pupils open wide, allowing the doctor to see the back of the eye clearly. With a better view of the back of the eye, the doctor can look for signs of the common eye diseases that can lead to blindness: glaucoma, diabetic retinopathy, and age-related macular degeneration. When eyes are dilated, the doctor can clearly see the retina, optic nerve, and the macula. This is the optic nerve. The doctor is looking for early signs of glaucoma. This patient's optic nerve is healthy. But here's what it would look like if it showed signs of glaucoma. The doctor will see changes in the shape or color of the optic nerve. The doctor may also see what is called cupping of the optic disc. Glaucoma is most common in African Americans over the age of 40, people over 60, and in people with a family history of glaucoma. In addition to the optic nerve, the doctor can also clearly see the retina at the back of the eye. The doctor might see signs of diabetic retinopathy. Early diabetic retinopathy starts with small red dots called microaneurysms and can progress to leaking blood vessels, causing thickening of the retina and blurring of vision, or new blood vessel growth that can bleed and cause blindness. If you have diabetes, you are at risk for diabetic retinopathy. While still examining the retina, the doctor can also look for signs of age-related macular degeneration, or AMD. If this patient had AMD, the doctor would see yellow spots beneath the retina, called drusen, or dark clumps of pigment. AMD is the main cause of visual impairment and blindness in older Americans. Dilation enables doctors to get a better view of the back of the eye, which allows them to determine whether there are early symptoms of disease. But it's important to know that all people older than 60 need a comprehensive dilated eye exam each year and should inform their doctor right away if they begin to have problems with their sight. People at higher risk may need to have a dilated eye exam more often. Risk factors, including race, age, and family history, are all important to determine how often patients should receive a comprehensive dilated eye exam. To learn more about comprehensive dilated eye exams, common vision problems, and eye disease, visit www.nei.nih.gov/healthy eyes.